Good day, everybody. My name is Bridget Onoiribholo Iweriebor. I am here to present my article on the taxation and nurses on the role of traditional healer, that is alternative medicine, in the healthcare system in Niger Delta of Nigeria. Summary of my study. The medical team have created so much awareness for themselves in Nigeria as their acceptance is more and more on the increase. The massive advertisement is going on the media, on the trade fair, and every other venue for advertisements. The perception of nurses on the role of traditional healer is accommodated in Niger Delta of Nigeria. As the traditional healer are important in the health system of Nigeria. So the perception of nurses on the role of traditional healer in the healthcare system in Niger Delta in Nigeria has resulted to problems and concern in the need to integrate traditional medicine and their practitioners into the health stream of the healthcare system globally and even particularly in Nigeria. The perception of nurses is not well understood, and the bias toward the traditional medicine by the government is that of receiving no attention needed by them in order to join them to the health team, to make them scientifically updated and hygiene improved. The traditional healers are often members of the community, and they understood their culture, their norms, and their tradition. So they can be very useful in giving first aid treatment, in preventing illnesses, and curative into the grassroots in the community. The availability, accessibility, and affordability of their effectiveness in the management of the health care system is considered critically in the primary health care delivery. As Nigeria is judged as one of the poorest countries of the world, when you are talking of medical treatment, even when the government tries to give free health care, everybody cannot be accessible to it. Statement of the problem. The perception of nursing and the role of traditional healer, alternative medicine, in the healthcare system in Niger Delta have resulted to problems and concern on the need to integrate the traditional medicine and their practitioner into the main health stream care of the system globally and in particular Nigeria. One of such challenges is the structural formation of the healthcare system and the position of traditional healer in the healthcare system. Traditional healer often they have the belief that with the support of formal heads, these indigenous and traditional healers can organize their efforts to improve the health of the community and the general society and their members. This has necessitated this study to examine the perception of nurses on the role of traditional healer and engender the delivery of qualitative health care to the people through the cooperation and collaboration. The method used for this study. The survey research design was used in this study. The study was carried out in Niger Delta area of Nigeria. 78 nurses were used as a sample. 7 nurses selected from the state hospital. 20 were drawn from private hospital. 12 drawn from other working companies as safety personnel. Target population was drawn from the total population of 718 nurses in the area. Yeah. And the research and the 10% of the population was taken, which is 10 over 78, 10 over 780 over 101, which gives us the 78 as the sample we use for this study. The sample technique was stratified random sampling to select the sample size. The result. The descriptive statistic of frequency count and percentage were used in analyzing demographic characteristics and research questions. And my return rate was 100%. As I distributed the questionnaire, and I waited to collect it immediately. Result was 100%. From the different table above, table 3 particularly show that 24 of the nurses agreed to affirmative. Only 2%, only 3% of nurses, however, agreed that it was done with their consent, because 24 agreed they have taken treatment from native doctor or traditional healers. But they said they were under the medicine of their relatives. They were not really know what they were doing. But 2 agreed that they were aware that they took their consent. References. These are my references from our Destiny SK 2012, Traditional Medical Care in Nigeria, and others. Conclusion. The study revealed that the level of acceptance of nurses on the role of traditional healer in the healthcare system is 12%, which is very low. It was also discovered that traditional healers are not accessible and affordable as many thought to be. The study revealed only 15% positive responses from the 78 samples. This was in the light of modern society, which motivates largely every desire, money, or financial background. It has been argued that there are a lot of fake traditional healers, and it's largely those ones that society has really come in contact with. And because money drives them, the fake traditional healer gives arbitrary charges and extort money from their clients. And you find out that a lot of people which are supposed to benefit from their activities, which are members of their community, cannot easily benefited from them. Discussion, future step. The study can be expanded to include the perception of nurses among the African Americans. The herbalist should intensify and the registration with the National Agency for Food and Drugs Administration and Control to ensure standardization and efficiency. Scientific procedures should be established to improve the practice of traditional medicine. Courses on traditional medicine should be introduced in training of nurses to medical doctors. This will increase their exposure and thus appreciate traditional medicine. Thank you.